Okay, to those of you on the line, we're going to go in 5 minutes. We're just waiting for people to come into the room and for people to log on. Unmute.
Hi, everybody. Welcome. My name is Jen Garcia, and I'm the HIMSS Chapter Student Engagement Chair. Welcome to Keeping an Eye on Innovation in Healthcare. Tonight, we have four really wonderful speakers talking about their roles in innovation in healthcare here at Bellevue College. You folks online, we are also waiting for a couple of students coming in for our in-person event here at Bellevue College. I can go ahead and just share a couple of slides, talk about HIMSS. You guys can see it.
This is what they see.
Okay.
So they're sharing.
Okay. So yeah, we have the welcome slide. So welcome everybody. So many of you might be wondering what HIMSS stands for. Healthcare Information Management Systems Society. We have a little information about what our history is, founded in 1961. The HIMSS Washington Chapter. Okay, yeah, so the HIMSS Washington Chapter, several different board members, and all of us are industry professionals that are really, really passionate about health information management, health information technology. What we're trying to create, especially for the HIMSS Washington Chapter, is kind of build this community of passionate folks together to talk about our industry, the trends that we're seeing, the interests and like the obstacles that we're all kind of going through, and just kind of grow this community, all focused on health information management, health technology, and healthcare innovation. And just sharing some more information about HIMSS and how it's a global advisor. We have a global conference that happens this year. It'll be in Orlando, Florida, March 11th through the 15th. As you can read on the screen, what our mission and vision is, as well as other information of like other areas or other regions that we touch as a global organization. There's our mission and vision. So to start our program, I'd like to go ahead and have our panelists introduce themselves. We have 4 with us today. As you can see on the screen, we have their names and their positions, but I'm going to have you guys kind of introduce yourselves, your role, as well as the companies that you guys are a part of. I will go ahead and I will start with McKenna. Go ahead and introduce yourself, your role, and who you work with.
Excuse me, Jennifer. Lisa and we can't hear the speakers.
It's in front of them.
Thanks for letting us know. Hold on. We are problem solving right now.
Okay, thank you.
Yeah, thank you.
Yeah, see,
Yeah.
I'll see if the hell has it.
Yeah.
Here, try that.
Can you hear us now?
Can you hear it? Well, I could try moving it.
Yes, we can hear it now. Thank you.
Oh, okay, great.
Oh, I was.
Awesome. Okay.
Maybe
Can
we
you
should.
still hear me?
Yes, we can still hear you now.
Yeah, that's
Okay.
great. Much better. Thank you.
Scoot it over.
Yeah, I think that's what I thought. Can you still hear?
Yes.
Awesome. Okay.
Well, McKenna, maybe you could
Yeah,
try speaking.
Perfect.
Otherwise, get closer around the owl.
Good. Hi, everyone. My name is McKenna Kosprensich. I am an account executive at Microsoft in the healthcare and life sciences industry. And what that means is I help to manage the overall relationship between 4 hospital systems in the Pacific Northwest and Microsoft.
Could you hear her? Could you hear her?
Yes. Yes.
Okay.
My name is Chad Heiner. I'm the Senior Vice President at Envoke, company based out of Boulder, Colorado. And I manage the product teams, which include the product owners, the support team, implementation, and training teams. And then recently handed off the customer success team that I helped grow to the commercial team. So that's me.
Perfect. Hi, I'm Carly Neal. I'm the Director of Digital Patient Access, Care, and Engagement at Seattle Children's. We say DPACE, so I'll say that from here on out. It's synonymous with digital health, and we have 3 tiers: virtual care. We oversee all the telehealth across the care continuum at Seattle Children's. We have an access and engagement team that has digital health tools to improve access for patients and families. And immersive engagement has our digital distraction, entertainment, and education for the kids.
Hi, my name's Lakshmi Venu. I'm CEO and co-founder of a startup called Major Boost here in Bellevue. And Major Boost provides AI co-pilots for phone calls. So in healthcare, there are some phone calls that are particularly tedious, but they have to happen, like phone calls to insurance companies. And we help make those calls easier with AI to facilitate the boring parts of the call that may not need a human.
Awesome. Okay, well, wonderful. Welcome, all 4 of you. We're so glad to have you guys here as our speakers today. I know a lot of students are very, very interested in career path. And I know we have 2 folks that kind of started out with a clinical background. We have 2 folks that are non-clinical on our panel today. And so, yeah, I know students are really interested in, okay, so previous roles that you had, education programs, degrees, certificates, and also, you know, what sparked your interest or passion in your profession? I'm going to start actually with Carly.
Oh,
Carly's-
So I did start out as a critical care nurse, and then I switched into informatics. To be honest, it started out as kind of a control thing. We were on paper, and then I wanted to kind of be a part of what we built in the EHR. So I kind of wanted to be on the front line of that. And then it piqued an interest for improving patient experience and clinician experience with technology. So I spent about a decade in informatics and then switched to an RN coordinator role in virtual care. And that was pre-pandemic. So trying to get people to use telehealth pre-pandemic. And then that expanded during the pandemic. And that resulted in a manager role overseeing scaling telehealth for a national healthcare company across the country. And then I went and got my master's in healthcare administration to expand my leadership capabilities in the industry. And that's when I got my director position at Seattle Children's.
So now I'm going to let you popcorn off to whoever you choose to talk about their career path. Who would you like to choose?
Well, I think ours are very similar, so maybe I'll popcorn and tell you.
Sure.
Yeah.
Yeah. So I started out as a nurse, critical care nurse. I was in the Army Nurse Corps after college, and came back, got out of the Army and started working at Harborview, and spent about 10 years in the trauma and surgical ICU there, and was really looking for an out of the bedside critical care career path. I didn't really see myself continuing at the bedside much longer. And there was an informatics program that was just starting at the University of Washington, SIPCT, which there's a number of us here from there. And I was I think I was in like the second year group, graduated from that program about 15 years ago, and worked in the informatics department at Harborview for a number of years. During deployments with upgrades with Cerner, which is Orca, they call it. And then outpatient was Epic. And then there were other applications that were used. And I was one of the lead analysts for CPOE. So in that case, you have to interface with all the different departments. And that kind of gave me a really good understanding of how orders were processed, but also just really highlighted for me the importance of clinical workflow and how disruptive technology can be if it doesn't have a clinical leader who can, kind of map out the way the current process works and then what technology is going to do. And we saw and we've heard for years how disruptive it's been for a lot of clinicians. In fact, some of them quit as a result of electronic health records, right? And others. I mean, one of the biggest problems we have in the industry today really is this infusion of technology without really understanding how disruptive it can be. And now you see a lot of innovative technology kind of trying to fill that gap or make it more usable. And so I bet a lot of what you hear today from us is how do we make technology more usable? How do you get through a phone call without having to spend 45 minutes pushing buttons or using IVR or something like that? And that's a lot about what Microsoft and what Envoke does. So anyway, how I transitioned to where I'm at now was I was recruited by this startup company called Envoke, and they were really interested in growing a healthcare vertical with their technology. And they wanted somebody who understood clinical informatics, how data flows and how workflows can be optimized using technology. And that was 10 years ago. So it's been an interesting journey. I will just, before I pass it off, I'll tell you what's happening right now from my lens is it used to be like you had vendors in technology and you had hospital systems and clinics, and now there's just like meshing of them. So you see Microsoft working with Children's, and you see all these different hospital systems working with big tech companies and a lot of small startup companies. And so there's lots of opportunity, and there's lots of just sort of the everything's being sort of you need the best of both worlds to make it to make it work. So
Chad,
there you have it. Yeah.
who do you choose to go next to talk about their career path?
Go ahead.
Jenna.
We'll save the best for last. The CEO gets the last.
True. I definitely have quite a different background than Carly and Chad here. I went to the University of Washington and graduated in 2020, so I'm a recent graduate. But I actually studied finance, sales, and education, so I have no healthcare background whatsoever. And I was placed into the healthcare industry when I interviewed at Microsoft. That was just where the role happened to be available, and they put me in there. So everything I've learned about the industry has been a learn by doing or by asking type of situation. I'm fortunate because Microsoft has a lot of positions that they're called industry advisors, and they're actually people who have worked in the industry, like Carly and like Chad. And they come and work at Microsoft to advise the sales teams on how to pitch the product or how to tailor your pitch to an actual healthcare situation. And so I've learned a lot through those individuals, but then also there's some internal programs at Microsoft that are led by these industry advisors, and they're really focused on training those who don't have a healthcare background on like basically a crash course of the healthcare industry or what you need to know in order to get by and talk to individuals. So I'm still learning, and there's more to learn every day. As you guys all know, healthcare is so complex and intricate, but it's been a great industry to be thrown into for sure.
So I'm Lakshmi. I've got a lot of experience in healthcare, but always on the business side. So I guess most people are students, so I'll start more from the beginning. So most people in my family, everyone except for me pretty much is a doctor. And so I kind of grew up in healthcare, hearing about healthcare a lot, making slides, writing documents for people, all kinds of things, like helping with presentations. After college, I went to work at Procter & Gamble, where I had a supply chain role. So, and I worked on the pharmaceutical business. So I negotiated contracts for buying raw materials and working on product launches to make sure the supply chain was in order for products to go out. So that was interesting. Then technology things started happening. So I moved to a technology focused role in like strategy and biz dev. Worked next at Express Scripts, which is a pharmacy benefits manager. So it's on the insurance side, which kind of all the providers or doctors in my family were not happy about because those sides are often like this in healthcare. But I wanted to see what that side was like and understand how payers make decisions and be a part of that. And then I worked in long-term care for a distribution company that provides all sorts of things for aging people. So that was interesting. I ran marketing and market intelligence for them. Let's see. And then after that, joined Amazon, where I didn't do anything healthcare at all, but I started working on AI. So that was exciting for me. Like I was at the beginning of what's still a growing and emerging field. And I went to Amazon to work there because I wanted to start my own company. And Amazon is so good at innovating in new, very different business lines, like started selling books, launched a Kindle, made AWS, and now has like so many different businesses. So I wanted to learn how they do that. What's their decision-making process? And I went there specifically for that reason. So after several years of doing that, I led a great global team and an AI product that generated a lot of profit for Amazon every year, and then decided to do my own startup. And when it came to that, I realized, oh, I know so much about healthcare. I could help businesses in healthcare that can't hire Amazon engineers. So that's how I got to this point.
Very cool. I think it's so interesting listening to all of you kind of summarize your career paths, how it's not like a straight shot linear thing. Like a lot of your guys' experience has been just either, an opportunity, preparation for like some kind of kismet of like, oh, we have a recruiter here that we're part of Invoke, we want to, and then 10 years later, here's, your position, right? Yeah, things are not, I don't think there are very many jobs now out there where it's like you do the job, you stay there for 30 years, and that's your career. I think what's happening now in our day and age is how career paths are so non-linear, and they're just like you follow your interest, you find an opportunity, you build and get closer to something. Maybe you fail, maybe you win, and you just kind of keep moving forward. And I think like these stories that you guys are sharing about, what you've been seeing or what your perspective is so valuable to students or even folks that are early careerists that are just trying to think, where do I pivot out to? So yeah, thank you for sharing like the little summary of your guys' career path. It's so important to hear. I wanted to talk about, so each of you are in a job role where innovation is the common theme, or where your role is a part of creating new solutions using technology in healthcare. And so I wanted each of you guys to kind of share, an example of a project that you guys finished, just so students and folks online can hear, what exactly, is like innovation in healthcare. I'm going to start with, let's see. Lakshmi, I'll start with you.
Yeah, so when I started Major Boost, I was looking around for what company to start. So I actually just went into clinics and watched people do their job. And sometimes they let me record on my phone, so I did that. And there's so many great products that have launched over the years that make people's jobs easier. Most of them are on a computer. And then I noticed there's this phone sitting there, and it's separate. And every time they have to pick up the phone, they kind of hate it. And whatever they talk to the phone, then they go over and they type it in here. And then sometimes they're reading off the screen and they say it into the phone. And sometimes, most of the time, there's actually a pen and paper too. And they're writing some other stuff down. So as I watched this, I was like, oh, no one has digitized the phone. It's the dumbest piece of plastic on the desk today. we say we have a smartphone, which is like super cool, but that's not what they're using at work. That's for fun and like staying in touch with your family. It's important too, like, but it's not what they're using at work. So I thought, okay, this is like a space we could start innovating. But really like finding the opportunity is looking for inefficiencies and pain points that are out there. And that's what a lot of good product development is still about.
So, okay, I'm gonna let
So-
you choose who would go next.
Oh, let's see. I'll pick McKenna.
Okay, cool. Well, my role is somewhat unique in the sense that I am tasked with creating and maintaining relationships of people in hospital systems and in my 4 customers that are local here, but then also advising them on what technology is latest and greatest and in the least vendor way I can do possible, because we want to be that trusted advisor ultimately. And so there's a little bit of a dance that you have to play in that regard in terms of I'm not pushing product necessarily all the time. It's more so trying to understand their problems and maybe in a healthcare industry, like our solution isn't the best out there. There's another partner or a competitive solution that I would suggest one way or another. So that's a whole navigation piece in itself. But there are really cool projects being done. And one that I've worked on most recently is one focused on patient throughput. And so basically it's for inpatients. And the faster a patient gets through a hospital system, the more money the hospital system will make. And so one of my hospital systems is totally focused on this right now, all across the board. It doesn't matter who their executive is, they're all tasked with trying to figure out a more efficient way to get patients through the hospital. And one of the way we navigated that conversation is we really had them like reverse demo to us. So the hospital is reverse demo their whole day essentially of what it takes to get a patient through. And this whole day is kicked off with a rounding meeting at the beginning of the day. And the solution that we're working on with them currently is focused around using our AI technologies to summarize their rounding meeting. Their rounding meetings are held on Teams today. So the AI technology will summarize their rounding meeting and will actually tell them like room 416, that person won't be discharged today because of this issue. Room 519, this person is on track to be discharged today. And it's going to summarize that. It's going to take out all the fluff if there were any conversations in between, and it's going to ingest that right into their system of record so that the doctors don't have to take the notes. They don't have to pull the transcription. It can just automatically be there. And then they can eventually get some analytics on it. So if say they come back the next day and room 416 actually did discharge, what was the triaging, what actually happened, and pull those insights and stuff. And so it's all focused on getting them out faster, learning from like what actually happens in the hospital system. And it's interesting. There's some really nuanced use cases that you can out there. So
Super cool.
So McKenna, I noticed on your LinkedIn,
yeah,
when I was like checking you out on
Yeah.
LinkedIn, I noticed that one of the titles that you have on there is Healthcare Innovation Driver. And I never really heard about that term before.
yeah.
And so like the team that you work with, like, is that your guys's like key word?
Healthcare innovation driver?
Yeah, how did you guys come up with healthcare innovation?
I think so. I think
driver?
any tech company likes to think they're driving innovation. I think how I see it is when I talk to someone at one of my customers and they just tell me a list of their problems, and I take that list and I'm able to formulate it to a technology that either helps to solve or mitigate or maybe diffuse for a moment one of those issues. I think that's how I see healthcare innovation driver personally, and I think we are doing that. It's happening every day, and so that's one of the cool things about working at a tech company in the healthcare space is like you get to see those use cases all the time, and you actually do believe that you're driving innovation to an extent.
I think it's really cool. Okay,
Yeah.
so you go ahead and choose who goes
Oh.
next.
Oh man, Chad, do you want to go?
Sure. So the question again is around what are we doing company wise?
Yeah, so an example of like a project
Yeah.
that you're working on
Okay.
for innovation in healthcare. It like specific examples
Yeah.
are really helpful to.
Okay.
students to
Yeah,
able
that-
to imagine like, oh, could that be a role that I could do,
Yeah,
right?
there's a couple that come to mind. So the company that I work for, we developed specialty language models for speech recognition in the cloud. And it's more than just, general medicine for physicians. It actually breaks it all the way down to RNs, hospice RNs, social workers, physical therapists, occupational therapists, chaplains. They're all using a form of speech recognition. Now, if you use it on your iPhone or use it on Google, it's non-HIPAA compliant. It doesn't have medical dictionaries. So you're not going to get the same level of accuracy or security or privacy. So there's a large group of clinicians that are out there, taking care of patients in their homes. And so that's one way that we were able to take technology that was primarily developed for physicians, nuance. A lot of people know what it is, right? And it was so you have this technology that you used to have to install locally and then on servers, and now is in the cloud. We've always been in the cloud. So that's one way of technology, right? Just you could go to scale by using cloud-based services and then pushing it out to mobile devices and maintaining the same level of security and privacy. It just opens up the usability to more than just physicians. And what it also does is it drives down the cost, right? So in order to purchase Nuance, Dragon Medical One, or now Microsoft, I don't know what they're calling it, it's a couple $1,000s. I mean, I think the DAC's like $10,000 a month or something like that. It's really expensive. So you're not going to get a hospital, right? Children's hospitals are not going to give that to nurses. Certainly not. But you can give it to home healthcare workers for like $25 a user per month, right? So you take that same SaaS-based model. So it's business innovation paired with technology innovation. One of the things we're working on with, and this is why I was mentioning, hospitals, agencies are really looking for vendor partners. They want technology companies. They don't have an IT group in the hospital. They're just trying to keep the lights on, right? Most hospitals are really hampered by the technology that they're currently having to support, right? If you got ambulatory, inpatient, radiology, lab, all of them, they're looking for technology innovation partners. And so if you can build a good relationship with them that's based on trust, then they will open up their book of business to you and show you what their problems are. Typically it comes down to like 3 or 4 things: efficiency, so physician clinical efficiency and documentation or workflow through rounding, quality, so everything's got to be a high quality in order to get reimbursed. And then it's either clinician satisfaction, which by the way is the #1 industry problem we have in the world in healthcare today, is clinician satisfaction, retention, and recruitment of clinical workers, especially in the home healthcare and acute care space. My wife's a critical care nurse at Harborview. She comes at home every night fried. It's a tough job. And so, providing them tools that can help them be more efficient and provide quality clinician satisfaction. Happy clinicians have happy patients, right? So if you take care of the clinicians, they'll take care of the patients. And so those are the things: quality, efficiency, clinician satisfaction, patient satisfaction. And if you're helping the agencies, or I say agencies because home healthcare agencies is who we work with primarily, if you're helping them solve those business problems, you'll be a trusted partner. So it's understanding what their problems are, coming up with a solution, as McKenna was saying, to help them address that. One recent one we're working with an agency is identifying early patients that are high risk for falls in the home. And so you can look at, what is the cause of the fall, and you say, oh, they have, they don't have they don't have handrails, they have loose rugs, they have stairs, that puts them at high risk. And those are just kind of individual data points. Or what we're going to do with this agency is take about 10,000 of their notes of patients that have fallen in the home. And we're going to run that through a language model, and we're going to figure out what are the commonalities, what put that person at high risk, and be able to provide back to that clinician in real time their risk based off of the documentation that's taking place. So it's, again, leveraging AI type technology with large data sets to find meaningful information. And so and then getting it in the hands of the clinical people. So that's one example.
So in the virtual care space, what I think we're seeing in innovation is technology can create innovative care models. So things that people are wanting now more days since the pandemic is telehealth and asynchronous modes of care. I think a lot of in younger generations too, we want the kind of asynchronous care or telehealth for convenience, and it improves access. So at Seattle Children's, we implemented a virtual urgent care for the parents. So that expanded urgent care access to our Seattle Children's specialists across Washington state. We also see 25% of our ambulatory visits via virtual care as well. Virtual consults is another one. So our neonatologists are very specialized, and we have teledoc carts in some community hospitals. So our neonatologists are able to beam in and even help with like neonate CPR at the community hospitals to
Wow.
help with
That's cool.
yeah it helps them keep the care closer to home, and also help some of those community hospitals care for very sick kids. And then we're also working on asynchronous provider to provider consults. And that's for external PCPs to be able to write an e-consult to a Seattle Children's specialist for that asynchronous consult. Right now it's a telephone, and that's not very easy for either provider to drop what they're doing to connect. So that asynchronous mode of care is important. Some other fun things, we have iPad for kids. So in all the hospital rooms, we provide digital distraction education that I mentioned earlier, and that's age appropriate, either streaming or gaming on their iPads. Just a lot of little fun projects. One is we have an iPad that we can give kids, and then it goes through a person to approve, and then they could see their art that they drew on the iPad up on display in the waiting room. So I just love some of those smaller little projects that kind of helps with the patient experience. And then in the access space, we're working on a project to help the parents maybe talk with a chat bot first, and then escalate to a real person. Because right now, again, in healthcare, it's very archaic in some of, you just call and wait and wait. And so trying to catch up with some of the other industries where there is that texting capability with a bot, and then escalation to a person.
Carly, I'm curious, how big is your team?
We got some approved positions. So we have 25.
Okay.
Yeah.
That's cool.
Okay,
It's
wow.
really patient centric, isn't it?
Yes,
Yeah.
yes. We are very patient and family focused right now. So a lot of the clinician stuff goes to a different team.
Yeah.
Yeah.
It's really cool.
Wow, that's awesome. Okay. All four of us answered that. Okay.
Yeah.
The question I'm like tracking. Okay. All right. So, one of the things that students are struggling with when they're trying to find jobs is like appropriate job role terms to search for. Specialist is thrown out a lot. Like, specialist, analyst is thrown out a lot. But, in the spaces that you guys are in, I'd like to know if you guys are using those terms, or if there are different terms out there that students or other folks that are trying to, that are being early careerists or are early careerists should be on the lookout for. So like Lakshmi, examples of job search terms that you would throw out there for students to take a look at.
Yeah, I guess it really depends on your functional area. So some of the terms in tech that are newer, I think there's a role called customer success oftentimes, which is really focusing, on the customer who's usually buying the software, but much like it's needed throughout, because we always want to get as close to the patient as possible generally, but they're really focused on making sure the customer is getting everything they can, that communication is coming back to the tech folks who build the software, the engineers if needed, or the billing department, whoever it is, to make that customer successful. So that is an area that's been growing, it seems like. Project management is always there, or program management in some cases. That's really good if you have solid organizational skills and prioritization skills. Oftentimes you'll see in tech companies, there's a lot of talented people, but they don't always remember what the priorities are. So, and what timelines are. So those roles are really helpful. Yeah, the specialist part is kind of newer, I would say too. Like, I don't think 20 years ago we had jobs that had the title specialist. That's really come up because everybody wants to have their own area of responsibility. So they want to specialize in something, and it's just not as cool to be an assistant anymore. So I think specialist came out of that, but it is really indicating that this isn't a manager job. Like, this is a entry-level job. So specialist doesn't necessarily mean it's bad or uninteresting. It's just, you should ask what the career path is. Like, what's the path after I do this for a little while, and how long do people stay in this job?
How about you guys, like, throw out roles or things that, even in your own, you know, in your own companies, like, what have you seen that has been posted as like a job?
Yeah, I
role?
think in big tech, it's kind of interesting because there's a few different ways you could go about it. There's obviously the healthcare sector or like the healthcare industry in itself. So that's like technically where I would say there's different specialist roles or different sales roles or advisory roles that you can sit in the healthcare sector. So it's like someone like me could jump into the role, but I'm working with hospitals, even though I have no hospital experience. So they're wanting you to get that experience. And so those roles are called like account executives. There's also solution specialists. There's account technology leaders. So if you're really into more technology parts and you like the underlying application or want to solve those business problems, you can do roles like that. But if you're wanting to be more that industry advisor within the company, so you want to be the spotlight individual at Microsoft who knows all about healthcare, those roles are called like industry advisor, like I just said. There's healthcare global black belt. That's a term Microsoft coined that basically just means you're a subject matter expert. So they quite literally call some of those jobs like subject matter expert. And then also there's the research side and the side that really influences what the healthcare team does. And they're doing some pretty cool research projects. There's one that we're actually doing with Seattle Children's Hospital that has been ongoing for quite a few years with their SIDS program, their sudden infant death syndrome department. And it's been a big genomics research project that's been going on for a long time. And so that's a whole separate department within Microsoft in itself. My biggest suggestion is if you're looking for a healthcare job at a big tech firm, search healthcare. Like like all of these will come up because it's mentioned somewhere in the job application. And so you can read through the different options if you just search healthcare and life sciences or healthcare or something like that. It's a great way to start.
Well, I mean, I'll put a plug in for HIMSS, only because I think that when you join a professional organization like that, you get to network with a whole bunch of people and, you know, go into a HIMSS conference. If you get a chance to go, you can volunteer as a student and get some of it paid for. It's a great way to network. I mean, you can go scroll on big tech company websites and maybe you'll get an interview, or you can meet somebody face to face and exchange contact information and probably have a better chance, is my guess. Some of the roles, whether or not you want to be in a hospital-based setting, I think that you would probably be able to speak to those better. But when I was in the informatics department, so for the students who are just coming out, I don't know, what are your degrees in? Is it informatics? Healthcare informatics.
So yeah, let's kind of get a read of the room. Okay, so Bellevue College students, raise your hand. And the program here at Bellevue College, healthcare informatics, bachelor's, right? Two-year program? Am I correct?
Mhm.
Okay, and then master's program. So you are in which program? Yeah. UW Sub CT and then OGBAD, Health Informatics. Okay. Yeah, it's San Diego, right?
Yeah,
then-
so, you know, if you're looking for a vendor tech type company or looking to work in the hospital space, I think the job titles are a bit different. You know, from my experience, it seems like the roles on the hospital side in the informatics world were opportunities to like be on the deployment team or training team or support team. Like those are your kind of first entryway into the hospital, and then, or, you know, into that department. And then you can, other projects come up. You could be a project manager, You could be, work as an analyst. So there's quite a few analyst roles. A lot of my former colleagues, I see one in the room right now, were analysts who did work with deployments and things like that, and new technology, trained on new technology, and owned, like not owned, but supported a one of the applications in a bigger EHR, right? So those sort of application systems analyst type roles. On the vendor side, on the technology side, it's a lot of sales driven stuff. A lot of it is. If you're not a technical person, developer, engineer, the other side of the world is really marketing and sales, customer success. And those roles don't necessarily require somebody with a strong clinical background, because you're going to have an advisor. But for some of the positions that are out there, like sales engineer is a really good role. For somebody who's got an informatics background or understands healthcare, because the sales team needs somebody who understands the technology and can help explain it. They still have clinical analyst roles. That's another very common used term. We have a clinical technology advocate on our sales team. Those are a few of the.
Yeah, I think I'll second some that people said. So project management, program manager, product owner, analyst, informaticist. But I'll also second what McKenna said is, if you're searching for job titles and you're having an issue finding things, widen that net. So it's like specificity versus sensitivity, right? So like go a little bit wider. And so if I'm looking at a tech company, I'll search healthcare on Microsoft. If I'm looking at a startup, I'll probably just search the whole thing, because there's not
Right.
I'd search the whole site.
Yep.
If I'm looking at a healthcare organization, I'll look at certain departments. So I'll look in administration, I'll look in IT. So I very rarely just search for a specific title, just because people do call things different. A lot of the organizations.
Yeah, and I'm glad you're calling that out,
Yeah.
like specifically how to search.
Yeah.
Because I've had students ask me, and I'm like, oh, like, search like this. Like,
Yeah, just cast a wider
Yeah.
net. And yeah, it kind of different for the tech side versus the healthcare side too.
Yeah.
And also to Chad's point earlier, that most jobs are actually not found through online application. Most of the jobs, and a lot of interesting jobs for yourself, you'll find through networking. So meeting someone face to face goes a lot further.
And it seems like with LinkedIn, it kind of disrupted the whole job market search thing, right? Like you get your LinkedIn profile set up and now you're getting hit up with jobs all the time, right? So it just seems like it changes quite a bit.
Yeah, I actually met Chad at, I think the first time I met you was at a HIMSS Global conference, and we were both volunteering at the interoperability showcase.
That's right, yeah.
And I think like we had a break and we talked for like an hour and a half.
Yeah.
Yeah, and I was
That's
just
right.
like, tell me everything.
Yeah,
And so it was,
You're still at Children's?
yes, I'm still
Yeah,
at Children's,
okay.
yeah. Well,
People don't leave Children's once they start working at Children's.
Children's is a great place to be.
Maybe that would be a good place to.
Yeah.
Love children. So yeah, networking is definitely a great tool to leverage to be able to do your job search, because you're right, like being able to talk to people in a professional organization and kind of find out firsthand, hey, there's an opening over here. Like I could connect you with somebody if you'd like to talk to them, if you'd like to ask the hiring manager a couple of questions about the role.
Yeah, grow your network. You want to
Yeah.
get a job, grow your network. That's a good take home message.
I think it also doesn't have to be at these big in-person events. Like I reach out to people on LinkedIn all the time and just like ask them if they have time. And what you'll find is people love to talk about themselves, and like they love to talk about their jobs. And so you just have to come up with
What are you
questions.
talking about me?
Yeah. But I mean, that's how you network. At the end of the day, if there's a company you're specifically targeting, go search different individuals that work at that company and start reaching out to them. I guarantee you one of them will reply and say they're happy to chat. And that's all it takes, is just one person. And then you can always ask them for a referral for someone to chat to speak with after that. It's a chain effect, and by the end of it, you'll maybe have like an awareness of a job that's opening down the road that you might be interested in. So I highly encourage, just start reaching out to people. It's a little weird, but you get over it and it's very helpful.
Having recently posted and screened folks who applied for positions through LinkedIn, if there is a job that you specifically are interested in, do more than just check the box and send your generic resume. Like, follow up with it, send a private message, connect with them, learn a little bit about the company, tell them how you think you can help them. Like, give them something to bite into. Don't just push send, yes, apply, blindly apply and expect to like get a response back. Because a lot of people are just sort of, apply because it's so simple. So now we have to put in all these screening questions, in order to fill out the, I don't know if you've ever posted a job on LinkedIn, but if you have the options to like ask all these screening questions, and then that kind of weeds out a lot of folks. But if there is a job that you're specifically interested in, and that, I guess another, maybe just a piece of advice is find something you like, that you're kind of passionate about, or that you're kind of good at, right? And then follow that path. Because if you don't like what you're doing, or you're not very good at it, you're not going to enjoy the job. So there's lots of jobs out there. Find something you enjoy doing that you're passionate about.
Lots of wonderful take-home gems. Yes, feeling fired up. Okay. Okay. Another question that I wanted to ask you all is trends to watch. So what are trends in innovation in healthcare that you advise students to, keep an eye out for? Like, Carly, I'll start with you.
Well, okay, so I think I answered this differently than everybody. So I think it depends on what you're passionate about and an area of focus, because there's so much. I would say in innovation, what we are doing, I think we talked about this, is we're trying to solve problems. So I like people that are in the technology innovation space to understand healthcare problems, like what are we trying to solve, and understand what leaders and what clinicians are trying to solve, so that you can sell the innovation a little bit. You understand why we need this innovation. So if you're coming from a tech side, make sure you kind of understand healthcare problems. If you come from healthcare, you probably understand that a little bit easier. But I guess AI is a big one. I think everyone will probably mention AI. And all of the vendors are remarketing themselves as an AI company. So I think understanding that is also like, what is Gen AI? What, all the different types of AI. So if you are being sold product, you could kind of understand the difference. So that's probably the biggest one for me, is AI right now. I think probably everyone will mention that right now.
When you talk about AI, and I'm sure Lakshmi could, expand on it a lot deeper than the rest of us, but at a very basic level, it's just a big statistical model, right? And so if anybody tries to sell you something more than that, they're probably trying to sell you something, right? It's a big statistical model that comes up with an output. Now, you have about the different types of it: generative versus the symbolist versus convolutionist type, right? And some of the output is based on rules, and that's a different path that in order to get the correct answer that's repeatable, you have to have some rules-based approach to generative AI. And that's the last leg that I think a lot of people miss when they just use ChatGPT for something. So be a little bit skeptical if they're just throwing that buzzword out there. I would say it's hyped up right now. It's at the very top of the hype cycle right now. It'll start coming down. But
Yeah.
Sorry.
Yeah.
No, I was gonna say, that's one of the things that I was gonna mention is I figured most people would talk about AI, but I think in healthcare specifically, it's really responsible or ethical AI
Yeah.
is more the buzzword that we need to be looking at. And I think that's what a lot of hospital systems have been forced to look at, is when ChatGPT became available, they were like, block, because I don't want my doctors to be typing anything into it, and I don't want anyone asking random questions that might leak potential PHI data and whatnot. So there's a lot of conversation around how to even approach it in the healthcare space, and everyone's completely different. And it's not to say anyone is wrong and anyone is right, because it's so new that we're constantly learning and constantly evolving in terms of responsible AI and ethical AI and how it's really going to be applied in healthcare. So it's a really fascinating topic, and I'm sure we can all talk about it for forever. And the one other topic I did want to hit on, and I know Chad talked about this earlier, but interoperability of data. I think that's huge. That's going to solve a lot of potential problems or historical problems of just having disparate sets of data within a healthcare organization. I think it's going to streamline a lot of workflows. It's going to make doctors' lives better. It's going to make patients' lives better, and it's a hot topic right now as well.
Everyone's talking about AI. I'm always excited to talk about AI too. But one I think that's also, very important is cybersecurity. And I think you can have an entire career in front of you on cybersecurity. There's a lot of data in healthcare, and it opens a lot of doors for bad actors, unfortunately. And so just always being on top of that and vigilant is super important. And the bad actors
Touching you, Dub, right now.
Yeah, I mean, there have been so many cases, like my info was all, like leaked on Primera, like everybody's had this problem. And bad actors, it's like a game of whack-a-mole, like they just find some new spot and you whack them there and they come up here, and it's always going to be there. So I think it's a very good career path, and we need smart people to work in that space. And there's different sides of it, like the hospital clinic side. There's the vendors, the tech vendors, and lots of intermediaries in healthcare too. So I think that's really important. And then like another general trend on the patient care side that I think is emerging is like there's a challenge now to the hospitals, right? Like about the hospital business model itself. Like it's a real estate based model. Does all that stuff need to be in the hospital? Sometimes the insurance doesn't want to pay for it because it's in the hospital. So I think Chad's business is really interesting because insurance wants people to stay at home. And that's sort of where Carly's innovation is too. It's like, well, I don't want to drive. I love Children's. Thank you, Children's, for all you guys do.
Yeah.
I love you guys. But if I can, if I don't need to be in the ER, can I avoid that? Like, yes, thank you for letting us avoid that as parents. So I think there's a lot around home health that's going to be super interesting that emerges. And like getting in with one of these places early and understanding how does it work. We're still at the tip of the spear. Like we're not even like into home health yet. So I think it's going to be a really exciting space, actually. So those my tips.
Yeah, I mean, one you always got to follow the money, and if you look at some of the big purchases that United Healthcare, Optum, they're all buying home healthcare agencies, like buying them. LHC, Gentiva, and Medisys, they're all getting bought by insurance.
They're catching
companies.
wind of the vision, and they're
So
like,
if an insurance
"That's-"
company has an incentive to keep somebody out of the hospital and they're going to pay for home care and not inpatient care, follow the money.
Yep. And even some of the CMS, like the reimbursement
Don't tell me
guidelines
wants
for
to go to
Medicare are
home health
changing, which like when Medicaid changes, that's how everything else, that's the way they force change.
Yeah.
And so like, when they start changing that it's happening. So it's going to be, I mean, it's good to know that as a consumer of healthcare generally, like when you look for your care or your parents' care in the future, that these things options are going to be really different.
Interesting stuff. Okay, so to the audience and folks at home, we do have one last question left, but if any of you guys have any questions, well, we're kind of a small group, so I don't think we have to use the Post-it notes that I put out to write questions on, but we will be doing like an open Q&A session. If the folks at home would like to write anything in the chat about a question or a topic that we haven't covered yet, before I end with this last question, go ahead and do that now. That would be great. But yeah, start thinking about your guys' questions here in the room with us. So last question is the final reflection and advice. Any advice for students or early careerists on their career journey, like, tangible tools for interviewing or resources that we should know about? Other examples. Chad, I'll start with you.
I mean, I probably have a lot of bias towards things. Again, I would try to make it more personable. If you're gonna apply for a role, like do a little bit of homework. It's pretty easy for somebody who looks at resumes and looks at LinkedIn responses to weed out those who are kind of just fishing versus those that are like, this is what I want to do. And if you can demonstrate that, you know, that this is what you want to do because you align with their mission and their vision and you bring something to the table, make that evident. Don't be shy about that. Make it personable. And that's gonna, that will help set you apart from the, you know, those out there that are just, you know, hoping somebody calls them and offers them a $200,000 job to work 20 days a week from 20 hours a week from home, right? Like that's what everybody wants, right? But that's not what you're gonna get if you don't, you know. I don't know. That's kind of my advice.
Yeah, I think some other tangible tools. For me, if I'm really serious about a position, I'll update my resume based off of the position. So if I'm just like, there's a lot of times I just put it in because I think interviewing is a good skill to have, and so it'll be practice. But if I'm really serious about a position, I'll update the verbiage to kind of use how they talk at their organization. I feel like that helps get past that first stage because it does go through a recruiter before it comes to like me or the hiring managers. And so that kind of helps get through that door. And let's see, if you do interview and you don't get a position, just see if they are open to talking to you about like what you could do in the future to improve either your interviewing skills or your resume for experience. I've done that with a few people and I'm always open to that. And I think it's good feedback. Yeah, I think those are two kind of things that I've seen be successful in the interviewing.
Cool. Lakshmi.
Yeah, so in terms of like interviewing, I guess I would advise people to network and like look for what you find exciting, or there's a lot of information because you're a student. You can always do informational, like ask people for advice or information instead of asking them for a job. And I mean, sometimes it's good to ask for a job, but you can also learn quite a bit without it. And just sort of open more doors for yourself and have more conversations, build a relationship with somebody. It takes time. It's a lot of time and effort, but you may end up in a better spot. When you do interview, like I did a session with HIMSS last year, I think, where I gave some interview advice, but one of the ones I like is like try to structure your answers in the terms of like context, action, result. Like, so give a little background, tell people what you did, and then don't forget to toot your own horn and tell them what your result was and why that was significant. Yeah, I think in terms of like jobs, like always go for things where you get responsibility and you are growing like step to step. But like if there's an opportunity to take responsibility, go for it because that's what makes you grow. It makes you more confident and it sets you up for like a different career path. So always take responsibility.
I'm gonna sound like a broken record, but I think you probably won't get a tech job, a big tech job, unless you are networking. Yeah, you can almost guarantee if you're just putting your resume in there, it's not going to get picked out of a hat. I actually had my manager tell me recently he's a part of a hiring loop, and he was just saying like I see so many resumes, I don't really look at them anymore. It's more who do I know that's in the bunch, who has reached out to me, who has showed interest in the position, and like Chad said, actually has a genuine interest in working in this position. So. When I first started, actually, I didn't know anyone in big tech. There were events that were put on by the University of Washington and Microsoft came and spoke at one, and I really hit it off with one of the guys there. After the session, I came up and started asking him questions, and then I applied that evening and actually got an interview that week, and he was my first round interviewer. So you never know who you're going to talk to. You never know what is going to like make or break your resume going through or not going through. But I highly encourage you to attend any events that any of your schools put on. Like I said, reach out on LinkedIn because you still have to grow your network there as well. But then just make sure you're always putting your best foot forward and making your name known and why you want to be there known.
Very cool. Okay, so now we're at our Q&A session. Anybody in the audience, do you have any questions for our speakers? This is your time to shine, y'all.
Go ahead with that, and then we got one.
I think Chad, at one point you mentioned like looking at LinkedIn profiles. I think I updated my LinkedIn like 5 years ago and really haven't touched it since. Haven't modernized it. What are you looking for with LinkedIn profiles? Like how much information is helpful, or is it less is more?
I mean,
or
I think
keywords?
the basic things is, you know, what your current role is, what some of your responsibilities are in your current role, how long you've been in that role. You know, where you get a lot of consultants, right? So you see that like had multiple jobs, they're switching every year. That's kind of a red flag for me. I think that, you know, if you have something interesting in your profile that speaks more to who you are, right? When you're working in especially in a smaller company, like you work with them so closely, spend a lot of time with them. You want to interact with people that are, you know, kind and you know, responsive and respectful and all those sort of things and if you can demonstrate that in some way that, you know, I don't know, volunteer at the local dog shelter or something. I don't know, you know, I mean, that you think that that's silly, but it's true. Like it kind of speaks to who you are a little bit. I think that stuff kind of goes a long way. Most of the people who are going to apply for the positions have some background in what, you know, what they're applying, you know, what role they're applying towards. I always find it interesting when somebody tries to, you know, take a step and say, I've not done this role before, but I've done this role and this role and this role, and I'm really interested in this one. That kind of jumps out to me. Like, okay, I want somebody who's interested in the role, who's not just going to show up, but actually is going to help drive value for the company. And that's kind of hard to tease out, but making it a little more personal, that's what I would say.
I actually had my recruiter at Microsoft, after I got the job, they tell you that they actually look at your LinkedIn profile because LinkedIn is a product of ours. And so they like to see that you're actively utilizing it, which I thought was really interesting for them to admit that.
Yeah.
So I would encourage you to make sure your profile is up to date if you're actively looking for a job, or comment on a post every once in a while.
Yeah, and I think it's the same thing. If you're trying to grow your network, and this is just like social media 101, you have to give before you get, right? So if you don't go out and like and share industry specific stuff, try to be somewhat of a little bit of an influencer, even if you're not deep into it. But if there's people in your network that you want them to promote you, or if you want them to, you know, make a reference to, like, you got to give a little bit first before you ask. That's kind of the rules out there. Is you're not going to get a lot of response if you're not actively engaged in networking as well. It's a give get.
Can I admit something? I don't go on LinkedIn. I don't look, so that's one, so it depends, right?
Yeah.
And so just like in tech, probably it's a little like heavier, but it's just like the resumes that come in. So like our team, I don't think we look at it. And it's it's hard. I think in the healthcare provider side, you get a lot of tech trying to reach out. And so it's almost like a full-time job to keep up with the messages that you get. And so I avoid LinkedIn a lot.
So what catches for you, Carly, then what catches like your eye, like how Chad kind of gave that example of, so say that there's a person who's just honestly like, I don't have that specific experience, but I have these kind of experiences to, you know, back up, you know, what I could be offering you. I'd really like to apply for that job. Like, what has been your experience when you are
Like resumes?
Yeah, resumes or like interviews, like interesting interviews where you're like, that person's memorable. Let me
Yeah.
write a note.
Yeah, I mean, if you have good interviewing skills, so it's not just like the hard skills, you don't always have the exact experience. So if you come from the tech side and you're interviewing for healthcare, kind of saying like, oh, I don't have that exact experience, but I implemented something similar, and kind of tying it to it and talking about results is really important. Same with healthcare. You may not have all of the technical experience, but if you've been a super user, I've been in informatics, and you're trying to make the jump, I think speaking to those, and sometimes that's a lot of like soft skills and personality as well. So if you don't have the experience, like being really like personable in your interview can go a long way. And some of those soft skills of like, I don't know how to do this specific thing, but I've done this, and I'm really good at learning quickly on my feet and going to people if I need help. So I think some of those soft skills to highlight if you don't have the experience. Because I agree, like going for something where there's growth, there's going to be some things that you don't have the experience in. So kind of explaining how you would get up to speed in those positions is important.
Jimmy, anything to add?
The question was specifically about
The
LinkedIn,
yeah,
right?
yeah.
Yeah. Yeah, I mean, I have similar points to everyone else. I do notice that there are not a lot of people on the hospital or clinic side of healthcare on LinkedIn. And people have tried to create social media for them, and it doesn't work, because like wherever they go, then the salespeople go there, and then they don't want to be there because they don't want to talk to salespeople, which is good. Like they should use their time to talk to patients and do other important things. So yeah, that's actually one of the gaps in like the social media products. They don't reach them effectively. But yeah, I think for simplicity, you could just duplicate your resume on there.
Easier.
Yeah, and
With
then
the format, you can export your resume, export your LinkedIn profile to a resume. It's like a resume builder.
and
So-
then like to Chad's other point, like there's just so much garbage that we get through LinkedIn. Like there's people who have nothing to do with our jobs that it's so easy for them to apply. And so we have these filtering questions that we add, but even those, like we'll say you must have these programming languages, and then they'll click that they don't have any and they still apply. And so it's the filters basically are there, but they also don't really do the job. So that's where it's like, okay, you shouldn't have to like talk to people and go to conferences and stuff like that, but it does help. But we do look at all of the resumes, actually. Like we actually do look, because there's candidates who want to remove that bias factor that when you go to in-person meetings, or you go to like anything in person or through networking, there's a bias factor there that certain people are getting remembered, certain people are getting picked, and other people are not. So we always try to look at all the resumes as much as we can, but like that's always there. So just keep that in mind.
So I
Right, we
think,
got one online.
yeah, we have
All
one
right.
online.
So online, can you discuss any current or upcoming challenges in health informatics that your organization is addressing other than ethics with AI or privacy measures?
Well, I mean, like I said earlier, I think the biggest challenge we have in the industry today is the recruitment and retention of clinical staff. And so, if you're developing technology that is disruptive to workflows and creating more work, that would be a problem. So I would say, to answer that question, cybersecurity, super important. AI, big buzzword, everybody's talking about it. How do you do it? How do you use it ethically? Those aren't going away. The biggest challenge is going to be how do we continue to modernize our clinicians and give them the tools and to meet all the requirements that are being thrown at them, and not go home every night, burned out and sitting at their kitchen table completing their documentation remotely. Like how do we address that issue?
Yeah, I'd say all healthcare organizations are also facing a lot of financial problems right now. It's inflation for us. Everything's more expensive for us. It's more expensive for the healthcare organizations too. So you'll hear a lot of do more with less, which is, I think a better way to say it is, be creative in your processes and use technology to make it more efficient. So if there's anything where there's a product where it was manual work where you can automate it, that's going to help, and that's going to be more attractive to leaders, where you can maybe use less resources to do some of the processes that can be automated.
I think there's still a lot on just basic data, like clean data is still a problem in healthcare. It's like we kind of went through this whole big data thing 10 years ago, but we're still having that same problem. So, it's like garbage in, garbage out. So if you're doing all this AI and you have bad data, it doesn't help. Even if you apply rules on that, like I see lots of things like the same patient entered 4 different ways in an EHR. People are like nodding. That's still there. It's such a basic thing that we still have, right? Or some of these EHRs, they came out with macros to make it easier for people to type. Well, guess what? Like we saw 20 patients today and all of them have the same macros, like same text about every single patient. Interesting. So it's a lot of like strange things that have emerged as a result in the data. And I think there's limitations, like certainly to what can be achieved as a result, and just like the usefulness of all the data itself.
Data governance. I mean, that would be another problem that you could add that to the list of, who manages the data, who cleans up the data, scrubs the data before it gets applied in sort of downstream modeling and things like that. So just real quick, I posted a BI analyst role, business intelligence analyst role, and in one day I got 400 applicants. And so then I changed the filters. On, and so they had to like say, yes, I'm a US citizen. Yes, I've worked in the industry for a minimum of, 5 to 7 years. You can create these categories, and then that, filters it down. So the next, and I removed it after the 400, and then I reposted it, and that filtered it down to 100. But still, I don't have time to filter out 100, right? So if you don't have if startups don't have big HR companies, have to outsource that to some companies, then feeding you these resumes. So there's again, going back to, if I would have just gotten a LinkedIn message from that person who was really interested in this role and had a really sharp resume and they demonstrated some nice soft skills, that would have jumped out to me and I would have probably interviewed them much more than scouring through them. But I think it's a really good question around what are the problems that the industry is trying to solve for, and position yourself into one of those roles that I can help you solve for one of these problems. I've done it before.
Any other questions online?
No other questions? Oh.
I guess this question would be based on things you've discussed. Sorry, I'm Luke, Master's of Health and Informatics, Health Information Management, University of Washington. I guess we'd be focused at something McKenna had stated about using AI to summarize routing meetings. In a recent study with the free-form text within EHRs, they're seeing up to 55% duplicates of the previous visit in those reporting. And even discussing today with my primary care manager, as he's going through 4 different charts for myself, has there been an attempt to look at using AI to summarize these into digestible blocks for the providers prior to being able to see the patients? Because you're looking at now at patient records being 80 pages long, and they have a very short window of time to view this prior to visiting with them, and it cuts in the amount of time that the provider can spend educating and training patients.
Yes, in short, yes. That's actually something Microsoft is working on with Epic. That's one of the main use cases is helping to summarize the patient chart. Epic is one of the EMRs for those who don't know. So Epic actually, they just recently announced the partnership with Microsoft, and they're solely utilizing, the AI technologies of Azure OpenAI to apply it into their actual system. So that is #1 use case. They've also seen like helping doctors generate the patient discharge note. So that's a big time suck if you're trying to personalize it or embed medications in there as well. That's another use case that they're working on. So these are all public. You could actually search it. It's really cool to see what they're coming out with. I've watched a YouTube video recently of like their top 10 to 15 use cases that they're currently working on and planning to come out with. And this is all from Epic. Like they're using the Microsoft technology, but it's not necessarily like something we sell. It's all going to be embedded within the Epic platform, which is really, really cool. So yes, spot on. But then also I will say, I'll do a plug for Invoke and for Nuance Technologies and those two, like summarization of your patient visit as well. The ambient listening tools that are coming out and they're already out in the product is a really hot topic right now. In terms of the doctor won't even have to be typing in the information during your visit. It'll all be done through a recording with your permission, obviously. And that tool is really cool because it takes out all the fluff. It summarizes it in the exact way that the doctor wants to be summarized. So it's totally personalizable per each of the doctors. And then it will hopefully ingest it into Epic, and then Epic can then do that summarization. So it goes even a step further beyond just like the historical, really long chart information. Yeah.
I mean, the problem that you are surfacing here is that the whole problem of copy and paste and just pasting forward from previous visits. And that is it's a problem. I mean, everybody knows about it. It's been a problem for years. So the question is, why do they have to then document this multiple times? And this speaks to the workflow and the lack of workflow that gets incorporated during the deployments of this sort of technology. And if there's an efficiency workaround, a clinician will figure it out, right? A doctor will find a quicker way to do something if it's possible, even if it makes no sense, right? So that's the garbage in, garbage out, right? So if you're just copying forward from previous note, but you're not reviewing it and updating it appropriately because you don't have time, now you're just filling a database full of garbage. And now you want to make clinical decisions off of that. That's where AI gets bad. That's where it runs awry. So yeah, using technology that, telling that patient story, that's what you used to do. It's what we used to do. Soap notes, remember?
Yep.
Subjective, objective, we used to do that. And now it's like just point, click, drop down, radio button, done. And it's not useful. So we have to come up with a better way. And Epic and Microsoft are probably gonna, and Nuance, of course, maybe Invoke can play a little part in there.
Yeah, for sure. I have no power. I will say too, the Nuance technologies also can figure out sentiment of the individuals that are talking. So you can tell it will quite literally like call out on a line item saying like, Chad is pissed off with the doctor. He's mad he had to wait so long in the waiting room. Like it will literally, it's quite crazy how in depth and in detail it can get. But it's cool stuff.
I'll tell you one more just quick little story about a company that reached out to us. So again, we use speech recognition for mobile clinicians, people out doing home care visits. And they said, retention and recruitment is really tough for those clinicians, home health care clinicians in particular, have a really high turnover, like up to 40 to 50% of these agencies. And some of them are fully staffed by contract workers, right? So that's bad. So this company developed this sentiment recognizer. So they'll listen to the dictation that they're documenting their note, and then they'll be able to tell the agency, hey, this nurse is at high risk for because they're so mad or whatever, they're angry, or the tone of their voice is, and then they can so we didn't incorporate it, but it was a pitch that I saw recently. Cool. Yeah. So don't be surprised, if you get angry at a customer service person, if you don't get some, they're gonna know.
Yeah.
That's me on the phone. Speak to a representative.
Yeah. That's where you need her technology.
Well, the insurance company, we had that when I was at Express Scripts 15 years ago. The sentiment analysis is really old technology, so it's been around for a long time. But yeah, they escalate the call to a manager. Yeah.
It's a fun job. The escalation. The escalation manager. Don't pick
They get all the angry people. They get a
search term.
Yeah.
Escalation
probably get a
manager.
bonus for dealing with angry people.
Yeah, right.
So any other questions? Anything online, anything in the room?
So I'm Malaysia. I'm a CT.
Congratulations.
I'm currently a full-time nurse at the VA hospital, and I myself, if anyone knows about CPRS, is a very old system that we still use. There's lots of barriers to it, and there's lots of, I have to physically type out things instead of click the patient is okay. And in the year and almost a half that I've been there, there's been multiple barriers that come up, like the more tasks that we have to do. We now have the new moderate sedation evaluation template that we have to add to our notes, and it adds another 5 to 10 minutes to my charting. So I'm burnt.
What happened to Cerner? I thought
paused that, right?
I've been
an
hearing
Oracle.
Cerner since I was in nursing school. So
It's like a 10-year implementation
Yeah.
plan.
They paused
Did
it
they,
too, right?
did they
Last
get,
I
did
last
they
I
get
heard they
pulled?
stalled
No, I started out in Spokane.
Yeah,
I
Right.
started in post-
that was like
Spokane,
3-4 years
and,
ago.
like,
Wow.
They had problems in Spokane, so in Seattle delayed.
Yeah.
Okay, that makes
Um,
sense. So you're on like a
They never got
20-year-old
past site one.
EHR,
Yes, I had to
homegrown.
put in a work order through Vista, and it's like blue screen, like enter, up carrot, all these things
Yeah.
that we don't use normally.
Mhm.
So I personally am focusing on clinical workflow and how I can help my coworkers manage the administrative burden of charting.
Yes.
But I'm scared to move from bedside. So my question here is more emotional. Like we talked about how career paths are very nonlinear.
Yes.
How do you address, I guess, fear of
Oh,
walking into the new space? Because for me, I'm super passionate.
yes.
But then in the face of like professionals, well, I don't know. I'm not sure. Should I go for it? Should I?
Just fake it till you make it.
No, I would say we need people like you. So came from bedside and went to informatics, and that was kind of exactly like I joked and said it was like control, but it was like paper, and it was like I don't want what we had now being just put into the EHR. And so for a long time, it's a little bit of a delay gratification. You don't get like the bedside, I'm taking care of somebody, but you do get satisfaction. I felt like a gatekeeper for nursing because there's so many people that add on. It's like nursing should do this and nursing should do this, and they add on so much. And so if you feel passionately about that now at the bedside, we need you in the informatics because you are going to be kind of that gatekeeper to make sure like, oh, does nursing need to do this? Like that check and that balance. So yeah, I'd love, yeah, we could talk more, but don't be afraid if you have that passion now at the bedside, you'd be a great informaticist.
I would concur with everything she said.
I think it's so funny. So I'm a TikTok, Instagram like person. I'm scrolling and I see like inspirational quotes. And so like the one that I came up on like this week was, the magic you are looking for is in the work you are avoiding.
Ooh.
And so I was like, oh my God. I was like, yes, like need to share that with folks that are like, do I take that step? Right? Like, do I want to do this? I'm afraid to dip my toe in. Like, go for it. Try it. If you fail, you learn something, right?
Mm-hmm.
So yeah, I mean, I think like most of the students that are in this room, if I get a one-on-one, session with them, I'm just like, you are in the right place. You're in like the right community of folks that are all thinking the same thing. Yeah, the magic that you are looking for is in the work that you are avoiding. So do it, Malaysia. Like, try it. It's okay. Very nice.
Future CNIO right there.
Yeah.
Better.
Any other questions? Anything online?
Nothing online?
Okay. All right. So I think I wanted to share on our slides. Okay. Yeah. So just a couple of things I want to share or about HIMSS before we close is there are some student volunteer opportunities. I had mentioned, I think at the beginning of the program, about the HIMSS 24 Global Conference. They are looking for graduate students and undergraduate students to apply to be a program assistant volunteer. Applications are due Friday, December 8th. You can Google HIMSS.org and type in program assistant, and the application form will come up. You will need to be a student member in order to apply. I will send out this PowerPoint with the links. And of course, if you have any questions, you can reach out to us at wa.studentengagement@HIMSS chapter.org. Next slide. I think this slide might be about future upcoming events. On December 12th, our very own Eric Stewart from Bellevue College is going to be presenting a networking and mentoring for professional success presentation on December 12th. I also added the registration link up here in this PowerPoint. Our clinical informatics committee is putting on a CP HIMSS review course. Oh, okay. Never mind. But what else is coming up for the HIMSS kind of winter events is we are having a student summit on January 31st here at Bellevue College. It's going to be from 5 to 8 Wednesday evening. We are going to do in-person and live stream, and the registration link is also there above. You can also check these events out on our HIMSS Washington Chapter website. Just Google HIMSS WA events and you'll see all of these things. Let's see, next slide, please. Here's all our information to be able to inquire, volunteer, join a committee. As I mentioned before, we are trying to grow our community of HIM, HIT, healthcare informatics folks. And we are continually trying to do so, inviting everybody and trying to get everybody on board. So you can reach out to any of these emails or click on any of these links to be able to find us and find out more about us. And then, thank you all for attending online, in person. Thank you to our wonderful panelists for being here and having this discussion with us. This was wonderful. Thank you guys so much. You guys.
Thank you.
Okay, so let's all meet and mingle. Please eat all the snacks.
For the mug.
Meet and mingle.
Yeah,
Please eat
thanks.
all the snacks and you will be getting this PowerPoint. But everybody have a wonderful night and thank you so much.
Thank you.
Thanks.
Thank you.
Can we get like a